What to do to reduce blood cholesterol. Have your bad cholesterol levels, LDL, increased and you would like to reduce them without needing medication? It is possible to lower cholesterol naturally by making modifications to your diet. Through diet, you can reduce these levels by primarily removing cookies, fast food, and other ultra-processed foods. What to do to reduce blood cholesterol. Eliminate trans and hydrogenated fats from your diet. It has been scientifically proven that trans fats and hydrogenated fats are poison for the heart. They directly contribute to cardiovascular diseases. Remove all foods containing these types of fats from your diet. Ideally, in Brazil, do not even consume cookies, ice creams, and other ultra-processed products, as many of them are labeled 0% trans fat, but still contain trans fats, because if it is 0.2 g per serving, they do not need to declare the ingredient on the label. Hydrogenated fat is used in fast food diners and restaurants that do frying, while trans fats are added to cookies, sauces, snacks, ice creams, industrial cakes, breads, pies, chocolates, microwave products, etc. Eat more polyunsaturated and monounsaturated fats. These two types of fats help lower LDL. Monounsaturated fat, besides reducing LDL, protects levels of HDL, good cholesterol, and reduces the oxidation of lipoproteins. This oxidation can lead to clogged arteries. It is present in olive oil, canola oil, safflower oil, grapeseed oil, peanut oil, fish such as salmon, tuna, trout, herring, mackerel, seeds, nuts, avocado. Polyunsaturated fat reduces LDL and decreases the risk of heart disease, as well as reducing the risk of metabolic syndrome and type 2 diabetes. This fat is present in fatty fish such as salmon, mackerel, herring, tuna, as well as in shrimp and shellfish, and in seeds and nuts. Eat plenty of soluble fiber. We have already discussed on the site about foods rich in soluble and insoluble fibers. Soluble fiber is a group of compounds present in plants that dissolve in water and are not digested by humans. However, the bacteria in our gut, also known as probiotics, can digest it, reducing both types of bad cholesterol, LDL, and VLDL. The main sources of soluble fibers are lentils, peas, beans, natural oats, cassava, beetroot, carrot, whole grains, and some fruits like apples and citrus fruits. Avoid refined sugar and some types of grains. Try to eat as little refined sugar as possible and switch from white to whole grain rice. If you can't manage to avoid putting sugar in beverages like coffee, try replacing it with stevia, brown sugar, or honey. The only downside of stevia is that it becomes bitter in hot drinks. Exercise. Yes, physical exercise is still one of the biggest allies in reducing levels of bad cholesterol. The current recommendation is to do at least 30 minutes of exercise 3 times a week, then increase to 5 times a week. This exercise can be walking. Do not smoke. Smoking increases the risk of heart diseases as it causes cells to fail to return cholesterol from the vessel walls to the blood, causing an accumulation of fat plaques in the arteries. Foods that lower cholesterol. A short list of the main foods that reduce bad cholesterol: oats, barley and other whole grains, beans, eggplant and okra, nuts, almonds, peanuts, olive oil, canola oil, sunflower oil, safflower oil, avocado, apples, grapes, strawberries, citrus fruits, fatty fish such as salmon, mackerel, tuna, trout, herring.